alive, running, kicking, and I think that is why I'm here.
Uh, yeah, so I think you're thinking absolutely on the track. You're a doctor, right?
Yes.
You're a dentist.
Yes.
How come the idea of doing something like Pharma State came into your mind?
Akshay, look, I am a dentist and I have also done hospital administration.
Okay.
And what happens is when you are in the healthcare industry and have a management background, you actually see what all is going on in this industry. And my co-founder, he is also a doctor and has a similar background.
Would you like to
So,
introduce him?
yeah, he is Mr. Satish Gupta, and my personally is my husband.
Okay.
So that is one thing. But we both have a healthcare background and we both did management. So it was like we wanted to do something different. One thing is there in all entrepreneurs that we all want to do something different. But what happens is कि आप ढूंढते हो, you want to look at the arenas where you will be foreign. So healthcare industry, doctors के लिए बहुत कुछ, everything is happening in this arena. Doctors, people are creating apps, they are giving them specialized apps. But the backbone of this healthcare industry, that is pharmaceutical industry, it is a big one, and none of the entrepreneurs are active in that arena. So we were like, why not work for this pharma field? My co-founder was already working with pharma companies, and he suggested that let us do something for pharma industry. We have had one-to-one interactions with medical reps also. So we also got a look at this industry through their eyes, how they look at this pharma industry. So this is where it all started. We started as an online application at that time. The applications were running like create something app-wise because that leverages the idea on the technology. So this is where it all.
कब से कर रही हैं?
It was informally. It was started informally in 2016.
Okay, almost 2 years.
Yes, almost 2 years.
Okay. हमारे इस शो के थ्रू जो हम लोगों को मैसेज देते हैं, बेसिकली जितने भी लोग आज तक आए हैं, उन सब ने कुछ हट के किया, जैसे आपने अभी बोला, सब entrepreneurs wants to do something different. But इस जो आप कर रहे हैं, इस चीज से how is it going to make a difference in people's life, in masses' life? Because India is a country of mass. So anything and everything that you do, it should make a difference in their life. So do you think Pharma State will actually make a difference in people's life, or it is pure business that you're looking at the moment? Is it for well-being of people, or is it for the business of Swati Sinha?
Akshay, look, to start with on this, I would say a single line, that is, money will always follow the idea. Okay, so the idea here is, you are saying कि स्वाति इसमें क्या ऐसा है जो एक charity angle रहेगा या monetary रहेगा?
Charity नहीं बोल रहा हूँ, charity बिल्कुल नहीं बोल रहा हूँ.
Value creation.
Value creation जैसे, for example, कुछ ऐसी चीज हो जिससे लोगों की जिंदगी आसान हो जाए, या जिससे लोगों को जीने में थोड़ी सहूलियत आ जाए. आपकी इस फार्मा स्टेट ऐप से लोगों की जिंदगी में क्या असर पड़ने वाला है, वो मैं आपसे जानना चाहता हूँ. चैरिटी मैं बिल्कुल नहीं चाह रहा चैरिटी की, because I think charity is not business. Of course, you are doing it for business for sure, but what is the benefit that people are going to get out of it is what I'm trying to understand.
इस एप्लीकेशन में अक्षय, there is value for each and every stakeholder. अगर आप अभी इस एप्लीकेशन को देखोगे खोल के, the major attraction is the job portal. Let us look at that angle through this application.
Job portal.
Yes, there is an inbuilt job portal in this application.
Specifically catering to
life sciences and pharma industry.
Life sciences and pharma.
So I think today, if you look at India's scenario, it is unemployment which is going to be the biggest problem in coming times. So let us, not for everyone, but let us start from a section of this unemployed sector. and we are doing it for healthcare. You may say a bigger part is healthcare, but yes, pharma to be precise. So the job portal is a very unique sort of portal. It has, all sort. We have tried to give it a 360-degree approach to this job scenario. That means every type of job, whether it is a walk-in interview or any other type of job, a reference job, or a job which is posted by a consultant or a pharma HR himself, all are available here.
Okay.
So we are trying to organize this job industry. So currently, if you look at this application,
लेकिन job portals तो already बहुत सारे हैं.
Yes.
There are so many of them available.
There are many of them available.
How are you different from those guys?
If you currently see at the job portals which are available, they are catering to all industry. We cater to all industry. There is only a job angle. You will come here, you will upload your resume, and then you get a job. This is their model. We are not trying to do it this way. We are trying to organize the whole pharma industry. That means from the start, from the time where a graduates takes his degree of B Pharma till the time he is placed, he is in the industry, all the arenas of his employment, right from the start till the, you may say, whatever he pursues, we want to be there with the candidate. That means Pharma State has to be a partner right from recruitment to training him, upskilling him, and then helping him gain pre-employment if he misses something. So this is the way we want to do it. We do not want to be a whole soul job portal only. We want to be a whole soul for pharma. You may say we want to be the most trusted partner for pharma industry, all the stakeholders including universities, colleges, students, professionals to be there at Pharma State. We want them to be trusting us as the collaborative partner in their growth, in every stage of their growth, right from learning to giving learning. That means we are also looking at 25 plus years of pharma professionals who have this 25 plus years experience in their domain to be there available for training at Pharma State.
Okay. हर किसी entrepreneur के पास एक वजह होती है, एक बैकग्राउंड होता है, एक स्टोरी होती है. जैसे अर्बन क्रैप के फाउंडर के पास एक स्टोरी थी कि मुझे रात को मैकेनिक नहीं मिला तो मैंने अर्बन क्रैप शुरू किया. या कोई और भी स्टार्टअप, जितने भी स्टार्टअप आजकल इंडिया में हैं, हर किसी के पास एक स्टोरी है, एक बैकग्राउंड है, एक एक्सपीरियंस बेसिकली जिसको हम बोलते हैं, अनुभव हुआ कि जो अच्छा नहीं था और उसके बाद उन्होंने अपना एक स्टार्टअप शुरू किया. आपके साथ ऐसा कुछ हुआ या ये
नहीं? इसके साथ बहुत इमोशनल एंगल है, टू टेल यू द ट्रुथ.
तो उन्हें तो नहीं मारी है ना?
नहीं.
फिर ठीक है.
एंगल इज कि एमआर से इंटरेक्शन हमारा होता रहता था. आई वाज रनिंग माय क्लिनिक आल्सो, सो एमआर से इंटरेक्शन हमारा होता रहता है. So this happened twice with us. कि an MR came and just I am a very that type of person who will be having a talk with anyone who comes and says कि yeah ma'am we want to talk. So it was all an informal meeting and he said कि
This is when you were practicing?
Yes, I was practicing and later on it was re-emphasized by Satish also.
Hey ma'am, I like to stop you here. लोग कहते हैं डॉक्टर्स बहुत पैसा कमाते हैं. अब वो जो एक छवि, जो एक इमेज डॉक्टर्स की सबके दिमाग में बनी हुई है, वो यही है कि मुझे भी ऐसा लगता है कि डॉक्टर बहुत पैसा कमाते हैं. तो आपने वो पैसा कमाने वाली जगह छोड़ के 2 साल से आप इस पे कर रहे हैं. I think you're not generating really great revenue out of this business at the moment.
Right, I'm not.
Why would somebody do that? Do you think that's really a sane decision to have something which is a flourishing business and then you move on to something like this?
Actually, let me tell you, I told you one liner, money will always follow the idea. I want to earn value.
I have so many ideas every day. Money doesn't follow me at all.
Pursue it with passion. You will be getting it. I want to create value. लोग कहते हैं money कमाते हैं. I will say value कमाओ. कितना value आप lives में create कर पाओगे किसी एक, और technology है आज. You can build a network of 18,000 professionals at our application.
Wow.
So
Total pharma.
Yes, all pharma. And we have a very, very good social media reach today. And you may say all the social media portals, be it WhatsApp, Facebook, Twitter, whatever you name it, and we are there. We are live and kicking. So that story, I would follow up on that story.
Yeah,
What happened with the 20 years back, what happened earlier, it was like when a medical rep came to a city just to show or tell about the drug, doctors were there to receive him. That was the status of a medical rep in that times when there are so many companies were not flourishing, and doctors are actually giving respect to MRs. Sir, come and just tell us what new drug is there in this market. And today the scenario has been completely reversed. डॉक्टर के पास टाइम नहीं है, भैया तुम्हारी कंपनी का MR आया है, अपॉइंटमेंट के लिए भी टाइम नहीं है. बट आई थिंक वी शुड रियलाइज
कहीं ना कहीं मुझे लगता है कि MR को MR की तरह ट्रीट नहीं किया जाता है.
एग्जैक्टली
सेल्स वालों की तरह ट्रीट किया जाता है.
एग्जैक्टली एंड
उसमें कहीं ना कहीं डॉक्टर्स की गलती है.
डॉक्टर्स की भी और फार्मा
तो आप भी गलती मानती हैं कि आपकी गलती है?
गलती का आई वुड से गलती किसी की नहीं है. सिचुएशन इज लाइक दिस कि जहां आप एक रिस्पेक्टेड पर्सन हु वाज रिसीव्ड बाय ईच एंड एवरीवन फॉर अ वैल्यू, कि क्या वैल्यू लाए हो भाई आज मेरे लिए, दैट इज मिसिंग. टुडे एवरी मी टू इज देयर एंड डॉक्टर्स के पास बिल्कुल टाइम ही नहीं है. Me Too's means many drugs are there.
Okay.
और हर एक drug का
I thought you were talking about that Me Too thing which is happening in Bollywood nowadays. I got scared. Okay.
So the scientific basis जो drug का है, that is missing completely. So it is also business, sales, but this thing needs to be, somewhere it should stabilize. It should not be like a very disrespectful profession. या sales का काम है. That is not a disrespectful profession. That happened with now it is changing. The current pharma companies are now actually emphasizing on scientific facts, scientific background of the drugs through which they want to sell. It is not about just selling कि भाई मेरे को इतना amount बेचना है. Now big MNCs, you may say the visionaries of this field are thinking about scientific way of selling.
For Pharma
Then
State,
science.
वो जो so Pharma State wants to change the state of MRs. Is that what you're saying?
No, that is a story behind why there's an emotional angle towards why we started.
So I got that. But how would that help MRs to gain that respect or the value that you just discussed?
That angle. First of all, why they are disrespected. The profession is disrespected today. If you see, you want to empower these people. MR should be empowered. If I am empowered, I command value, I command respect. So the number one way that we want to empower them is through precise, important information that could be there, given to them through Pharma State. So we have information coming up regularly at this portal for MRs, about this industry, about their drugs, everything. Whatever, they should be knowing their industry. They should not only be selling, and that is how you empower them. You know your profession. Number two, empower them with jobs. If something is not suitable for them, give them a portal, give them a leeway. कि भाई today this job is there, tomorrow I will be somewhere else. You have power to command some respect there.
Of course.
Then you have training. I must tell you the state of medical representative education today is quite low. People are hiring anybody and everyone to just sell drugs, sell it. They do not even know how to speak English or give any scientific background.
So somewhere you will agree that the state of MRs is only because of the MRs, not because of doctors.
I must say that.
Okay. So training is also a part of Pharma State. Okay.
So we are trying to collaborate. We are now ready to collaborate with the training centers, whosoever in pharma field, with educational institutes as well, so that we the fresher tag of a B Pharma student or a pharma person is removed, and there is a tag of trained graduate coming in. That means you do not have a tag of fresher at your curriculum vitae, you have a tag of trained graduate there. Just remove that word fresher from your curriculum vitae.
I think that's going to help a lot of people. Currently the challenge with Indian job industry is that I would say if there are 1,000 jobs, there are 1,000 candidates also. People say that there are no jobs. Companies say that there are no candidates available. So the gap, the void which has been created because of the skills which are required to fit in for that particular job, I guess the pharma industry is also going through the same thing, right? Apart from this, so one is your job portal, second is training. But do you have anything else that you were actually clubbing with that everybody will get benefit from with in Pharma State?
It
Like
is.
I am not a doctor, I'm not an MR, or I am not even a pharma graduate. So if I want to utilize your service, how can I do that? मतलब मुझे क्या फायदा होने वाला Pharma State से?
It is not about that benefit angle, Akshay. It is about organizing pharma industry. So all stakeholders who are related to pharma, basically businesses also. If you're a manufacturer, you're a manufacturer. If I assume you're a manufacturer, a distributor, a wholesaler, a pharmacist guy, you are also going to gain.
Oh.
That means we are trying to organize this industry as a whole. All the stakeholders who are remotely, even remotely connected to this industry.
Like an e-commerce platform?
Not in e-commerce. We will have an angle of e-commerce later. There is a provision of creating your company pages and displaying your products right now. But that is all simple platform. So not into e-commerce right now. We are currently trying to be the backbone of this pharma industry for any sort of communication, any sort of networking they want to. That is the placement of this application today.
Okay. How are doctors going to benefit from this?
5 years down the line, actually, we hope that once we have pharma industry connecting using our portal, we may be able to deliver few very beneficial services to doctors also, because the backbone is pharma. Without medicines, doctors even cannot do. They want scientific information, they want continuous improvement in their knowledge about drugs, about reactions and all those things, and that is also part of pharma.
Are you somewhere competing with 1MG in practice?
No. We are not doing that. We are not commercial sort of selling type of portal. We just we are aiming to be the partner of growth in pharma professionals and industry.
Okay. So if I am a manufacturer, I am a reseller, I am a doctor, I am a pharma student, I am a pharma graduate, or whosoever I am, if I am related to pharma, Pharma State is the place for me to go.
Yes.
Where do you see yourself next 5 years? Of course not here. Maybe we can have better couches to sit on.
This is quite a good one.
Okay. Where do you see your company as a whole in next 5 years?
Okay, in 5 years, currently we are operating only in India. We are aiming in 5 years we would be the most trusted partner for pharma industry and stakeholders worldwide. Number one, and number two, we may be foraying into healthcare and giving more ideas related to pharma and healthcare.
What is the authentication? When you say that you're going to train people, you're going to have a job portal, you're going to provide jobs to people, what is the authentication? How would you authenticate your services to people? Why? Let's say I'm a pharma guy. How would you ensure that I will get a job after I get training through you guys? Have you tied up with some?
Yes. I'll answer that. The training institutes we are tying up are few are backed by government also. So we are wanting to, we would like to associate with government related certification programs also, and they will be delivered through Pharma State as a Pharma State collaborative partner. Plus we are tying up with private partners also and few institutes who are giving training also. So that way, currently it is all disorganized. People take the training, people do not know where to go now. Where is the job? I took the training, where is the job? But having a job portal, having technology at your back leverages you to give him the job. I have a job portal, we are running it, and we have we have a job portal, and as soon as the person is trained, we have created a pool of trained professionals, not freshers. I would say I want to change this word, this tag of fresher. People feel bad about it. So we will be creating that trained pool, and we will have pooling of jobs. So I think we are the right platform.
Are you looking for tie-ups from the industry?
Yes, we have done few also.
Do you want to say to people on this video, maybe, because this is going to reach out to a lot of people, so people can reach you out. How do they reach you out? Are you going to have? Do you have a website up? Of course you have.
Yes,
right?
we have an introductory website, and we have an online application which is free, completely free. Though everybody has a mobile today. Just go to the Play Store, type Pharma State, and it is there. have a look at the reviews also, because those matter today. Reviews of application matter today, and we have all those reviews there. So just download the application, connect with us. We are there. I am there at the application myself. My team is backing all of the candidates, and we will be soon approaching pharmacy colleges also to tie up with them in placing the candidates and training the candidates as well.
Okay, so also we will be putting in all the details of Pharma State, how you guys can contact Pharma State in the description. Maybe Swati's number, somebody's the number who is going to represent Pharma State. This is going to be, I think this is an ultimate platform for the future generation who is just graduating out of and looking at the current scenario, the job scenario that India is actually going through. This is going to boost up, one, the confidence, of course. Second, the employment rate will go high. The quality of people which are available, like for example, MR, the state of MR at the moment is probably because they have not been trained well enough to describe or to talk. They're just told to sell the medicine, not describe the medicine. What is the value of that medicine in people's life? So I think it is going to be a very good platform, and you're doing a great job, Swati. I think somewhere down the line, in next 5 years, I don't know if whatever you said that you'll be going across the globe. I wish you all the luck. But revenue-wise, I don't know. But yes, in terms of making people's life better, because future generation needs us. You know, they're the people who actually look up to us to have better solutions for their life. So maybe in 5 years down the line, the whole pharma industry will know Swati Sinha as you know.
I don't want that. I want Pharma State to be known as the most trusted partner. Be it a student, be it a professional, be it a business partner, whosoever is seeking alliances in the industry. So that way we see ourselves as creating jobs with value. We are not simply a job platform. There are n number of job platforms if you see. Big ones coming up on AI and blockchains also. So down the line we also want to integrate that technology into us. But yes, the value proposition lies here that we want to remove that tag of fresher. Plus, it should be a wholesome solution for anyone, the most trusted partner for a person who wants to make a career in pharma, who wants to gain knowledge, who wants to make network in pharma, and who wants to grow. So
Okay.
that is where we want to place ourselves.
Do you want to have a message for people across the industry? Maybe if you're looking for help, if you're looking for association, or if you're looking for more registration, or if you want more and more people to join with you. Are you funded already? No.
Not funded in that
So you're looking for funding also,
Yes,
right?
we are looking for funding.
So why don't you just pitch yourself here to people? Maybe
I think this discussion rightly pitched whatever idea we have for this pharma profession and healthcare industry. And currently we are looking for partners, for investors as well. And Pharma State aims to be the partner, the most trusted partner today. And let me call all of the pharma associated stakeholders to connect. Let's connect at Pharma State.
Pharma State is one of the best platforms that have actually come over across in last couple of months. They have a different model altogether. They have a different model of approaching people. They have a different business model altogether. I think everybody should actually once visit Pharma State and look at what they have to offer for people here. With that, we're going to conclude this. Swati, thank you so much for coming in here. I really appreciate your presence. Has been, I don't know what to say, gracious, glorious. Anyway, we'll close it here. Thank you, everyone. For more details, you can look at the description. Thanks.